Hey folks, thanks for joining me today. This is Ignacio, President of North Star Senior Advisors. Really quick about us, we've been here in Central Florida for about 6 years now. We provide a complimentary service, which is senior placement. We help seniors and families locate options in assisted living and memory care. We also started North Star Cares, geriatric care management services a couple of months ago, so we do care management as well. Today, I'm very excited to have Javier with me. So we've been looking for a little bit now to have this discussion around hospice. So I want to introduce my guest today, Javier Melendez. He's with Abbott Health Hospice Care of Central Florida. Javier, thanks for joining me today.
Oh, Ignacio, thank you for having us. I appreciate it very much. Appreciate the opportunity to be talking to your people and the people that you reach out to. It's a great opportunity, and I wouldn't have it any other way. So thanks.
Yeah, no, thank you. I know we said a little bit before this. There's a lot of questions about hospice. There's a lot of preconceived ideas about hospice, and we work with our clients and families, and we get asked a lot of questions specifically around hospice. So we really want to take the time today and have a little bit of a discussion, if you would, about hospice and what it is. And it made sense to go over some myths around hospice. And Javier, I know you got 5 myths that we're going to be discussing today specifically, and I think those are great. I'll recap these really quick for us. First one is hospice is where you go to die. Hospice is a place. Hospice means I'm going to die soon. Hospice is giving up. Once you choose hospice care, there is no turning back, and hospice requires a DNR. So those are questions or preconceived ideas about what hospice is. So I'm going to let you introduce yourself, Javier, and tell us a little bit about these myths.
Sure. And again, thanks for the opportunity, Ignacio. Once again, my name is Javier Melendez. I'm currently the Director of Business Development here at Abbott Health Hospice Care. I've been overall in the healthcare field for the last 22 years, in all of those in the outpatient setting. But I've been in hospice care for the last almost 9 years, and truly everything that I did before prepared me, for this role and for the hospice care in general. And that's really where I found my passion. I'm very passionate about hospice care. And when Ignacio reached out to me, I brought up to him, listen, discussing myths and misconceptions for people, I think will be a great way of breaking the ice on an uncomfortable topic, for most people, which is the end of life and hospice care, correct? Now, I selected what I believe to be the top 5, most common myths around hospice care. But believe me, and I know you all know, and Ignacio, you know as well, there are many more misconceptions and myths about hospice care. But these are truly, I believe, to be the top 5. And the first one that comes to mind, truly, in most people's minds, is that hospice is where you go to die, or the hospice is actually a place. And that's not true. As a matter of fact, hospice is actually a service. And it's a service that was designed or is designed to actually help the person, the patient, remain at home, wherever they call home. And that could be an actual residence, could be an assisted living facility, could be a skilled nursing facility, basically wherever they call home, right? When hospice was actually enacted as a benefit, as a Medicare hospice benefit in 1982, the idea was to mimic the hospital setting. In the hospital, when you go into the hospital, you receive care from a physician, you receive care from registered nurses, you receive care from chaplains, you receive care from volunteers, you receive care from a whole interdisciplinary team, right? That's exactly how it is in hospice as well. So hospice is designed to have that interdisciplinary team approach, but in the home environment. And it's very unique in that setting. Also, when you're in the hospital, you're not having to pick and choose whether you need to pay for a diaper or an underpad or supplies or cream or medications. Same thing in hospice care. Hospice care is an all-inclusive benefit, meaning that everything that the patient needs for their comfort and safety, it's provided by the hospice provider as an all-inclusive. So again, the idea is to help keep the patient and the family together at home, wherever they call home.
Great.
Of course, we do have our inpatient units, and that they're actually places, but those are designed just to for those times when you have you need an elevated level of care that cannot be provided in the home environment. But always the idea is to manage that decompensation, whatever that is, and then bring the patient back home.
Okay, got it. So hospice is not necessarily a place. It could be anywhere, any place you call home, right? And services are provided, and it sounds like Medicare covers that benefit, correct?
Yes, Medicare covers that at 100%.
Okay.
Medicaid as well. For those patients that are younger, not Medicare age, I have yet to encounter insurance in the community that does not have a hospice benefit. But moreover, even if a patient has no insurance or even has no legal status, so no way to being ever insured, if a patient is appropriate for hospice care, we will take care of them exactly as if they had the best insurance in the world, regardless of their ability to pay. So
Right.
don't ever let insurance status or otherwise negate the fact that you can access the hospice benefit. We're here for you.
Yeah, no, I appreciate you sharing that, and it is such a valuable benefit as well. So it's good to know those facts. The second myth you have here is hospice means I'm going to die soon, and I think that's one that I know I hear pretty common. From some families, sometimes there's hesitation on wanting to look for hospice because to the point here is that death is imminent. It's going to be happening very soon. So how would you help explain that one?
Sure. I mean, and obviously, one of the biggest obstacles we have in hospice care is that perception that when you say the word hospice, you immediately think that hospice equals death, and not only death, but death soon. That in most people's minds in the community, and even in the healthcare community, when you say the word hospice, what comes to mind is the image of someone on a deathbed about to pass. And unfortunately, that does become a self-fulfilling prophecy because we end up either getting the referrals too late for the healthcare providers, or the families and patients are too late to accept the benefits of hospice care, right? But the fact of the matter is that these patients, families and patients can benefit from hospice way sooner. And that's when we can do our best work. As a matter of fact, although hospice neither hastens nor prolongs death, patients with certain illnesses and diagnoses actually has been proven in certain studies to actually live longer lives than those that didn't choose hospice care. And at the end of the day, we send surveys to the families that we have serviced, and the number one comment we get over and over again is, I wish I had known about hospice sooner.
Yeah, and I would say education is key, right? As many things. I mean, we get similar things too when we work with families. They're like, I didn't know there was placement service. It would have made our lives so much easier going through you versus anything else. So we hear it, and I think that's part of what we do in healthcare is a big chunk of it is education, and really trying to educate the community on the benefits, specifically around hospice, because I agree. My mom passed away 3 years ago, and we had hospice, and I don't see how we would have, managed her transition without hospice. To be honest with you, it was tough, and it was a tremendous benefit. The other myth I have here is that hospice is giving up, right? We also hear that, so it's like a struggle. They want to look at different venues, and they think, well, if I do hospice, then I'm giving up on my loved one.
Yeah, and that's understandable. It's something that comes up quite often, and not only from patients but also from family members. They feel guilty about stopping or trying to pursue aggressive treatments. But when a patient reaches the end stage of a disease process, whatever that process is, right, and there's nothing that actually can be done to cure or make better that disease process, hospice care actually becomes that something more that can be done for that patient. Hospice empowers the patient and the family to actually live and choose living, right? Hospice becomes that option to make sure the patient lives their lives to their fullest, with the utmost dignity and comfort until the good Lord says so. Um, when we reach when we reach that point where nothing else can be done to make a disease process better, right? Prior to that point, a patient and a family have chosen to sacrifice their time, their dignity, aggravation, um, uh, time with loved ones, right? Imagine yourself in a hospital, back and forth, right? But patients and families choose to sacrifice that for the hope of more days on the back end, right? That's why you make that choice. But when hospice comes, right, when time for hospice comes, what we do is we shift focus, right? And as aggressive as we have been in the past trying to cure or make better that disease process, that's as aggressive as we're going to be from this point forward, managing the symptoms brought on by the disease process, so you can actually, the patient can actually choose to live and not worry about the disease, not worry about anything else, but just choose comfort, dignity, and make sure that they live their life to the fullest. In 2018, I received a call from a physician of mine, and it was very quick. He just told me, "Hey, Javier, I just spoke with Mrs. X, and I tried to talk to her about hospice, but she doesn't understand why she needs it. So I need you to give her a call and talk to her." And all he did was just give me her name and phone number, and that was it. I didn't know anything else. So I call, and the phone rings and rings and rings. And I'm about to hang up when finally somebody picks up the phone. And this person is out of breath. And she goes, "Hello?" And I'm like, "Oh, I'm so sorry. My name is Javier Melendez, with Advent Health Hospice Care. Um, I'm looking for Mrs. X. Am I calling the right residence?" And she goes, "Oh, yeah, that's me. I'm sorry. I was all the way on the other side of the house, sweeping the floor, and I came running to pick up the phone." And I'm like, in my mind, I'm like, "Well, no wonder this lady doesn't understand what she needs hospice, right?" Wow. So I compose myself and I apologize, and I said, "Well, listen, Doctor such and such asked me to call you." And she goes, "Oh, yeah, no, I want to talk to you." And then she told me her story. Long story short, about 3 years before our conversation, she had been diagnosed with breast cancer, and at that time, she had gone through first, second, and even third line therapies to try to cure the disease. And at some point afterwards, she actually had been declared cancer free. Unfortunately, about 2 weeks before our conversation, she had gone to her oncologist. And after doing some routine scans and follow-ups, the oncologist sat her down and said, "Listen, unfortunately, your cancer not only has returned, it actually has metastasized, and it was in different areas of her body." And he was very brave, and he said, "Listen, the last time, we gave it our all. We went through all these therapies, right? At this moment, I don't have anything that I could offer you to cure you. We could try, but there's no guarantees." And she told me that she told him at that moment, "Heck no, there's no way I'm going to go through that. I sacrificed during last time trying to cure the disease. I spent my whole time going from the bed to the bathroom, to the bathroom, to the couch, just feeling terrible, not being able to do anything. But I was doing that because I was trying to cure this disease, to give it a go. I am not willing to go through that again. I am not willing to go give it a try when I know that there's no guarantee for cure. I feel fine right now. I want to live my life. My husband is outside mowing the lawn. I want to spend time with him. I want to spend time with my kids. I want to spend time with my grandchildren. I want to go to the beach, to the parks, etc., etc. I want to live my life." Mm-hmm. And I told her at that time, "Listen, if I could, I would go to your house right now, take a picture, blow it up, put it on a billboard across I-4 with a caption that said, 'This is hospice,' because that's when we can do our best work." That lady, in less than 30, 45 seconds, told me exactly what mattered to her, what didn't matter to her, what was important and what wasn't. And that's when hospice can do our best work, when we can take a patient and a family by the hand, ensure that they live their life to their fullest, right? And we're just there to make that happen. She was 9.5 months on our services, and I will forever be grateful to her example, because that's exactly when we can do our best work. It's phenomenal.
You know, that's a really good example. Thank you for sharing that story. And a lot of people don't realize that part of it. Again, as we go back, right, it's always going to be a crisis situation, last minute, decision. To your point, the benefits can be so much greater if you really engage the service prior, right? So I'm hoping people that are watching, if anything, you take that away, right? That's important. The other one that I have here is that another myth is that once you're in hospice, that's it. You can never be discharged from hospice, leave hospice, then it's almost like you're done.
Yeah, no, that's nothing further from the truth. As I hope you guys get, your viewers get from this video, from this interaction, the patient and the family are the center of the care, for us, and they're the ones that are in control. The patient and the family always remain in control, and they can actually rescind services if they feel that hospice is not for them for whatever reason at any time without any penalty. And if they actually want to come back on services, which happens quite a bit, after they rescind, they can certainly come back so long as they're appropriate for hospice care. So yes, I mean, the family always remains in control. It's not just once you choose hospice, there's no turning back. That's absolutely incorrect. It's a myth, and throughout their journey in hospice is the patient and the family who are in control at all times, and that's quite different from the rest of the healthcare world. Let's say you go to a hospital, you're in a hospital bed as an inpatient. The doctor comes and dictates what's going to happen to you, et cetera, right? When you get admitted, when you get discharged. In hospice, is totally the opposite. We open the book for you. We tell you, these are the things that we can do. You tell me what you want. You tell me how you want it done, and then we'll help you achieve that.
Okay, excellent. Glad to hear. The last myth I have here, Javier, is that hospice requires a DNR, which, folks, that stands for did not resuscitate, status. Is that true?
Absolutely not. Absolutely not. The patient does not have to have a signed do not resuscitate order to access the hospice benefit. As a matter of fact, of course, our team will. Our ultimate goal is to ensure that a patient and family have the best possible experience and the most comfortable passing, right? If it ever, if it comes to that, and having a do not resuscitate order really helps for that purpose. So that's why it is our responsibility to ensure that we can educate the patient and family towards the benefits of having a do not resuscitate order. However, they don't have to do that. They don't have to have one, and they can, remain under hospice services without one. Now, I would challenge, this area, in particular in the Pacific Northwest. This order is not called a DNR, do not resuscitate. It's actually called an allow natural death. So when you put that in that perspective, right, it's quite different. It sounds way different. And if you present that as an option to a patient and a family of allowing natural death, how many more people would actually choose to sign an allow natural death order as opposed to a do not resuscitate order, right? It's just a little bit of verbiage, but that's why we are experts at what we do in terms of end of life care, and that's part of the conversations we have in terms of educating patients and families to ensure that that we always do what they want, and respect those wishes, whichever they want, whichever they are. But we do our best to educate them so that hopefully we can provide them with the best care and also the best possible death as well.
Excellent. All right. Well, Javier, those are great points. And folks, we could be here for quite a while. We wanted to keep it a little short today. We may consider coming back every so often. If Javier has the time, definitely to expand on additional topics. But these are we thought would be a great way to start. Folks, you're also going to see Javier's information down below in the video, Advent Health contact information. If you have any questions about hospice in general, any specific needs, he's going to be your go-to guy here, and he'll be able to answer those for you without a doubt. Javier, thanks again for taking the time today. I really appreciate it. This is a great topic.
No, Ignacio, thank you for the opportunity. And I really look forward to getting more of these done in the future for, for the benefit of your viewers. I'm really excited about being your associate here, in terms of hospice care. I appreciate it very much.
Excellent, excellent. Well, I appreciate it again, sir. You take care. We'll be in touch, okay?
Sounds good. Thank you so much, Ignacio. Have a good one, okay?
Thank you. You too.